Global Health. Thank you for joining us for our center's a monthly seminar series. And this particular session is oriented towards how do we connect to the national discourse around global health. You know, some of our seminars to date have been speaking internally as we've been trying to think about what we do and how we bring in our partners. So we'll spend some time thinking about that, but also review one of the venues where the National Discourse takes place, and that's the Consortium of Universities for Global Health. A special welcome, I believe we have colleagues from Ghana listening in late at night. So we hope to make it very much worth the while. Just a few words about our center. You can keep track of what we're doing at our website. And this again is a cross-university center where we're really collaborating for purposes of impact. I also wanted to point out that our website, you'll see a new one by the end of next week, where we really have a lot of updates about our activities and help on helping you understand how to engage, where we are with our membership program, and a lot of useful information. So check back. I think many of you know we're organized thematically across the center, and what we've chosen to do is to break up into what we call challenge groups. Some might think of these as action groups, but these are groups of faculty that have come together from across disciplines to gather and to chart a course for impact within each of these sections. The last one there is our newest one, Designing for Impact in Global Health. And that is all of these, you could read more about them. Again, at our website, you can actually view, you'll be able to view the past seminars. It is an organizing structure for us. We've just recently defined a grants program that come up through the challenge groups so that we can stay thematically organized. We also have a program for by which that we can choose impact scholars. Some might think of this as a postdoc program, but these are impact scholars who again connect challenge groups to our work, and more importantly, with our partners and colleagues in low-income countries. So again, all of that information will be forthcoming on our web, and it's how our faculty are coming together across the institution. So this evening, we're going to have a conversation about connecting to the national discourse. And we've chosen faculty, as you can see here, from several different schools who can reflect on some of their experiences with the recent national meeting of the Consortium of Universities for Global Health. And they'll be talking about some of their experiences, but as always, it'll be important for us to get the input and the discussion of the audience. And I'll be introducing them individually just prior to their a few remarks before we really head into discussion. So what's the agenda for this evening? One is we want to talk about why is it important to connect to conversations outside of the university. Well, of course, that is what we do. Is we're part of a larger academic community. But it's particularly important for us right now where we're at as a center. We're a relatively new center, and we're trying to figure out what's our niche going to be. When you're talking about global health, it's a pretty big field. Where are we going to decide to have impact? Our name, Global Health Equity, we realize hasn't really been charted or defined. So we're really grateful that one of our professors in the School of Public Health, L. August, is working with colleagues in Rwanda and actually several different continents to try and say, well, how do you define global health equity? Sounds like a great term. How do you define it? What does it mean? But one of the big jobs for our center is to define what big questions, what challenging goals are we going to really line up at and go after? If we end up trying to do everything, we'll end up doing nothing. So what are we going to prioritize, and where are we going to really aim our arrows? So we think that's a pretty important goal, to have our internal conversations, to have our conversations with our partners, but also to connect to the conversations about global health that are outside the university. Wanted to spend a little bit of time talking about where are the conversations on global health equity found. And then finally, where we're going to engage our panel is more around that question of just what about the Consortium of Universities for Global Health? Specifically, what is it? Who goes? What about the University of Michigan engagement before trying to speak a little bit to the highlights? We're going to, try and maintain an active chat group, as well as taking your questions and answers for the audience. So I said a few words about why I think it's important to connect to the conversations outside the university. But let's spend a little bit of time on this second bullet. Where are the conversations on global health equity found? So here's where I'd really value people putting into the chat box. Where do they tune into when they're trying to listen in and keep abreast of the greater conversations on global health, things outside the University of Michigan? Each of you are members of disciplines. There are huge disciplines that see the global health is very bedrock to what they do. I think of things like our School of Public Health, the public health meetings, sometimes the tropical medicine meetings. But any of you who want to weigh in on where you personally go to keep on top of the national discourse on global health equity. There's maybe two other places where I'd like to just make note of keeping track of the global health discussions before we go to CUGH, Global Health Now and Unite for Sight. Global Health Now is one of these places that, again, is very noteworthy for Johns Hopkins and the Bloomberg School of Public Health. I just find this as an excellent feed. It's a daily feed that I follow that just gives you the headlines on what's going on regarding global health and global health equity around the world. I find it's just the right size for me to at least know the headlines of what's taking place. It's very well curated, and you can go as deep as you want. But sometimes when people stop me and say, how do you stay abreast of everything that's going on? I just think that this is a highly reliable, highly informative feed, and would really recommend this for those of you who are trying to stay connected to the national discourse. Often academically, we've defined, staying abreast as going to national meetings. And for our disciplines, we would say, well, what about the global health meetings? And again, we're going to talk about CUGH, which is a major one, but I at least want to acknowledge there's another fairly substantial global health meeting that's called Unite for Sight. This is a global health meeting that's quite large and quite, there's a lot of different engagement that comes to Unite for Sight. I find it very popular as well with NGOs, the charitable foundations. It's very wide and very diverse in terms of its participation. They also have a very helpful website in terms of how people can keep track or keep engaged. And they also have a national meeting that's usually right around the time of CUGH. This was just a couple weeks ago. And it's always curious for me that often in many of our disciplines, there's a couple meetings and people will tend to go to A and less so B, and you talk to other people, they go to B a little bit more than A. So just be aware for those trying to keep track of the national discourse on global health. Unite for Sight is another meeting that's out there. But what we were going to try and do with this particular seminar is do a little bit of a deeper dive on the Consortium of Universities for Global Health. This is one that we're more engaged with as an institution. So we're going to spend a little bit more time on this while acknowledging there's other places where people go to stay connected to the wider conversations. But let me offer you maybe a few remarks about the consortium. This got started, about 14 years ago. And at the time I was at Gates Foundation. And the reason it got started is because so much of the global health funding was no longer going to universities. It was going more to NGOs and people who were viewed as being able to do the work, people who could implement and people who could take action. Often universities were viewed as ivory towers who could write papers, and people were working on their projects and getting samples, but they weren't oriented around implementation and taking action. So the academics were watching the global health movement pass them by. Universities were fading in terms of relevancy to the movement. So a group of universities started to come together to say, we need to change how we think. We need to change how we relate to this movement and to being relevant to the communities that we're called on to serve. And it's been growing. Right now, it's about 170 institutions. It's largely centered in North America, but it's also very much welcoming and open to institutions elsewhere. One of the things that I want to really emphasize is that you are all members. Because University of Michigan is a member of this, you're all members of CUGH. And so there are some resources and some activities that you at least want to be aware of, if not take advantage of, in addition to the meetings and some of the programming. And I think you could find that useful. So what are some of those things? Like any national organization, they have a number of committees and working groups, and these are faculty and it's very oriented towards learners in terms of getting people involved. There's a board of directors. I'm the rising chair of the board of directors, so I probably have a little bit of a disclosure here. Not that I get any compensation or any rewards for this, but again, we're trying to create a national community of practice among the academic institutions, much like we're trying to create one for our Center for Global Health Equity. One of the things people will often tune into, there's a great webinar series, and if you just look, this is just a listing of some of those webinars, just selected from the last half of this last academic year, to give you a flavor. But also the website, it's a good website, simple website, cugh.org, where you can go and search for topics. So for people who are trying to get introduced or started, or to find other people who are gathering on a particular topic, I think that this is a nice starting place. And then again, focusing down on tonight's discussion, there's an annual meeting, and this one was March 12th through the 14th. For somebody who's very active in planning the meeting, this is another one of those maddening dimensions of CUGH, where you're trying to figure out how to plan a meeting and can you hold it? Is this going to be face-to-face, or are you going to have to go virtual? We all realized fairly early on that this meeting, which was scheduled for Texas, was probably not going to happen face-to-face with what was going on. So we really did make the changes for it to go virtual. And this is always, whenever these annual meetings come together, it's always a combination of some institution in the area, but also partner institutions that are in other parts of the world, and this is where we were in partnership with Mexico. Lots of satellite sessions, and a lot of these sessions are up on the web. And for example, the satellite sessions are all free for you to watch. You don't need to be you have paid a registration fee. The plenary sessions, a lot of things are open to you on the web. But this meeting had about 2,000 participants, and so there were 2,000 people engaged for this particular meeting, and there were about just over 50 people from the University of Michigan who are participants. And if you looked at the footprint of where people were coming from, you can see the different schools that were represented. By design, this meeting, much like our center, is meant to collect people from as many different disciplines as possible. Long ago, we realized global health is not limited to people who are in the health sciences. It's very much a team approach that needs to come from the breadth of disciplines, such as what we have here at the University of Michigan. So out of the 52 attendees from the University of Michigan, about 12 of them were learners. So this meeting always attracts a fair number of learners, and that's good. It's good for networking, for learning, and for presenting. I don't know about you, but whenever I go to a national meeting, it can be fairly intimidating. I immediately feel inadequate by how many topics are being covered and the fact that I can only see a minority of them. So this is another busy meeting agenda, but thankfully it's organized into tracks. But hopefully you can see here the kinds of tracks that the topics are organized in. again, to things that are into, health science type issues, but, first and foremost, addressing the social determinants of health, something that most of our schools and many of our faculty and learners could contribute to and could engage with. So this is how the meeting ends up being organized. I'm always surprised when I go to these meetings to try and learn. One of the things I undoubtedly learn about is I meet people or become aware of faculty that I didn't know about. So this is one of these typical examples of one of the headliners, and on a session that you'll hear a little bit more about from one of our discussants is Elizabeth Roberts, and an anthropologist. We have one of the leading departments of anthropology in the country, and she was a panel discussant on this topic of that you can see listed here. Sorry, and I was unaware of it. So it was the type of thing after the conference I could call her up and say, we need to know more about your work and need to get educated for our center and our collective community. So there's always networking opportunities. We all could celebrate. There's a handful of awards at these sessions, but one of our own, Cheryl Moyer, in the Department of Learning Health Sciences, was the recipient of the Mid-Career Award, named after Thomas Hall and Nelson C. Combo. One of my favorite pictures of Cheryl, you can see her here learning and trying to understand from one of the many villages where she co-creates and partners in Ghana. So, and then finally, a lot of these national meetings are defined by their poster programs. Again, big tracks, but this is how the topics get defined, the tracks. And Michigan does really well. If you look at the participants from our schools of public health, from engineering, from nursing, School of Information, medical school, we have really good presentations and representations. So we have a really high profile at these meetings. So I wanted to give you a little bit of context about these meetings and where we try and go, try and gather and try and learn and understand the national discourse and try and figure out how to bring back some of that here. And now I'm going to just stop sharing my screen in just a moment as we kind of bring in some of our discussants to just offer some reflections. A few of them have maybe some slides or takeaways to show, but in terms of what they got out of the meeting or some of the takeaways that were particularly relevant for them. I want to start with somebody that I want you all to know. I think many of you already do, and that's Amy Conger. Amy Conger has been for some time over in the provost office. She's also faculty over in our School of Education, but she's our new managing director for the Center for Global Health Equity. And from her previous position, she's going to be so helpful in terms of pulling together the community from across the university. But Amy, I know this was kind of the first CUGH meeting for you. And I wonder if you could offer some of your thoughts, reflections, takeaways. Amy?
Sure. Thanks, Joe. Carrie's going to present my slides for me. And while we transition to that, Joe asked me to just share a little about myself. As he mentioned, I come to the center from the provost office. I've spent several years supporting the university's global engagement efforts, tending to some of our larger scale partnerships around the world. My background is in the social sciences and comparative education. I've studied the ways that different systems of higher education and training have evolved over time and how they're shaped by local context, meaning history, social movements, politics, and cultural values. So I was trained in ethnographic methods, and I did my graduate fieldwork in rural South Africa, but I'm not going to tell you the year. So in turn, this knowledge really informs how I think about and how we collectively can most effectively partner with institutions in other countries, how we navigate the differences, and how we co-create mutual benefit. I'm going to share a newcomer perspective with you. It was my first conference. I had a couple questions in mind as I approached the sessions, and I'll share some of my reactions and follow-up ideas. So literally a couple weeks into my role, along comes this wonderful conference, and thinking about my role, I'm here to help create an environment where you, as researchers and practitioners in global health equity, can do your best work. So with that goal in mind, it really shaped the way that I listened to the sessions. So first, what are others saying about the key elements of successful collaborations in global health? Secondly, where does my background make sense? How might I engage with this brand new community? And finally, just brainstorming a couple ideas for what we might bring back to the university, to the center, and also share with our global collaborators. So Carrie, if you could advance the slide. This was one of my starting questions, and you'll see that I have some text that I changed. I started with, okay, what do successful initiatives look like? And then I stopped because not all initiatives are collaborative. So I decided to change that word to collaborations, because when you think about the core values of the center, collaboration and co-design are really at the heart of what we do. So I was hoping to listen for the ways that colleagues describe their collaborations, the way they talked about it. You see some words on the left of the slide, kind of the anatomy of a partnership. And I was hoping that people might share some nuggets of wisdom or some lessons learned about how we build effective collaborations. Things like, what's the backstory? How were the relationships developed? Did you have a long time friendship with somebody? Was it a cold call? Who championed this partnerships? How did you engage leadership? Do people use language that suggests co-ownership or shared investment? And I'm always curious to hear people who are willing to talk openly about any pivots they may have made along the way, right? Pivot is kind of our nice word for mistake, error, blunder. But if you pivoted, why and how did you do it? What I found, or at least in the sessions that I attended, is there was a very quick zoom into the outcomes. So talking about the collaborations, it was about the outcomes. I wasn't really hearing much about the mechanics of the partnerships. And that's understandable given the time constraints of a conference, right? And multiple panelists and people wanting to maximize their time. But I want to reinforce that there is value in examining how collaborations are developed and nurtured over time. Because we know the relationships, the trust, the decision-making structures can actually affect the results. They can actually affect how impactful they are. And the backstory is something we tend to skim over, maybe a few sentences in a paper where the partnership was established in 2012 and that's all we need to know. So I think an interesting opportunity for the center and for our work is thinking about ways to document and describe our actual approaches to collaboration from the very earliest stages, build an evidence base for what collaboration and co-design looks like. And we're building a great team in the center. So this could be work that our center staff help with, but also our new impact scholars coming in. There is an initiative there to think about the science of collaboration and to get people from the very early days describing what we do and how we engage could be really useful later on. If we don't gather this from the start, it's going to be more difficult to unpack later, right? We're going to have to jog our memories and who did we talk to and what did this look like? And I think that as our projects mature, this will give us the ability to compare approaches to collaboration with the actual impact on the communities involved. So next slide, Carrie. The second question I'll just touch on quickly was a little more personal, and it was how do I navigate this new space? And so my natural inclination was to gravitate towards what felt familiar. And I've listed, I looked across sessions to think about disciplines that maybe weren't the usual suspects in global health, the social science, humanities, education, public policy, and others. And I just jotted down a few themes that emerged that seem quite relevant to our work in the center and could maybe help us think about new colleagues to engage. So first was that notion of structural competency, which is this holistic umbrella of addressing broader inequities and social determinants that affect the problem in question. The second is the value. We heard some colleagues talk about the value of long-term interdisciplinary fieldwork, which we all know is really hard for us to do. It's hard for us to be on the ground months or years at a time. But this particular colleague told these wonderful stories about when you're there, these natural experiments emerge and there's a chance for real-time learning. So, maybe as we think about supporting our learners, for example, we could support them in making longer term commitments to spending time in the communities. And finally, there was the notion of integrated ethnographic collaboration and really using new ways to illuminate the lived experiences of people where we're working in global health and inequality. And if we could go to the next slide, I want to spend a little bit of time kind of talking about that last bullet point of integrated ethnography. And Joe had mentioned the work of our colleague Liz Roberts, and that one really spoke to me. I think Liz did a couple really interesting things during her session that we don't always see. And the first was she shared her personal story of her own journey to how her background, her training, her contacts eventually led her to into this space of thinking about inequity and thinking about health, and talking about the community where she had been engaged for a long time before she met these environmental health scientists. And that was valuable because it helped me and others connect the dots across these very different boundaries and kind of see how it came together and how it made sense. She also provided a very concrete example of how researchers from very different backgrounds converged around a common theme. So in this case, anthropologists and environmental health researchers looking at the environmental determinants of health. And having that concrete story, I think, makes it easier for people to see themselves in this space and start making analogies and seeing connections with their own work. And finally, I even took I couldn't type fast enough, so I took a screenshot of part of her presentation, which is in the corner of this slide. And I thought she gave a really compelling illustration of how different methods can yield different results. Here she's putting side by side traditional survey methodology with ethnography, and really pushing a new boundary in something called bioethnography, which brings together the strengths of both ethnography and bioscience methods. And the obvious takeaway, as Joe mentioned earlier, is we need to invite her and other people like her to come and talk with our community and share the fuller story of how this work can happen and be very successful long term. The last point I noted here is, again, as a newcomer, it was very interesting to me to hear about people talking about this notion of decolonizing global health. And coming from an education background, this is something that our colleagues have been thinking about for decades, right? Going back to the late 60s and Paulo Freire's pedagogy of the oppressed, that was all about the relationship between the colonizer and the colonized in education. And it was a reminder that we have people on our campus and beyond who have been thinking about decolonizing structures for decades and one takeaway and a homework assignment for me and others is to find who those people are and how we might connect. And I'll pause there, Joe.
Great. Well, thank you, Amy. And I know that's going to stimulate some good conversation for the discussion. And next, if I could ask HaEun Lee to share some reflections. HaEun is a just graduating PhD student from our School of Nursing. And I really enjoyed her poster that she had at CUGH, but would love to hear what some of her perspectives were on the meeting, any takeaways, any thoughts on actually pulling together a poster or her project for this meeting. So HaEun, thank you for being with us.
Thank you, Dr. Kolars, for the introduction. Hi, everyone. My name is HaEun, and I'm at the School of Nursing. I primarily work with Dr. Jody Laurie and her global health research team, kind of advocating for marginalized women to better access reproductive health services. And I kind of appreciate some of the questions that you sent to all of us in advance. It definitely gave me a little bit more direction to reflect on my experience at CUGH. And I would like to focus on the first question that you gave us. What are some of my takeaways from the conference and any particular highlights or key takeaways for me personally that I would like to share? So I think one of the biggest things that I got out of CUGH was that it kind of provided me the space and time to take a step back and to be exposed to diverse topics that are happening globally and to kind of reflect on the interconnectedness of these topics. And so I don't know about the general audience here and who you are or like what your experience have been over the past couple of years. But to share a little bit more about myself, I'm not a US citizen nor a permanent resident here. I'm South Korean. I grew up in 7 different countries, but I've spent the past 10 years in the United States. And I think the past few years, America has been going through a lot, to say the least, with dealing with the COVID pandemic, the election, Black Lives Matter movement, Asian hate crimes, and a lot of things. And I think unknowingly, I've spent a lot of like my mental and emotional strength trying to focusing on like what's happening here locally and in this country. And I think attending CUGH kind of reminded me to take the step back and kind of look at the bigger picture and the things that are happening around the world and our priorities as a global community. Also, I think on the other hand, as researchers, we often get immersed in our own research topic as well. And CUGH also does a great job kind of connecting various topics and the overall importance to our global community as a whole. So broadly speaking, I do research related to advancing maternal health of vulnerable women in international settings through sustainable and evidence-based interventions. And maternal health and empowering minority women to better protect and promote their health is my research passion. But again, I sometimes lose focus on the big picture that maternal health is related to also children's health, infants' health, families' health, and like a nation's economic system. That there are various cultural, systematic, structural, and political systems around it. And CUGH is a great conference that helps me shift my perspective on all of these other topics that are connected to my research passion. So I think I was really grateful to be exposed to diverse topics that are important to the rest of our global community, and also how it focused on the interconnectedness of these topics. And to kind of like briefly touch on some of the sessions that I've attended and my takeaways from those sessions. There were obviously a lot of conversation about COVID-19 and how it impacted health and research for people within the United States and around the globe. But I also appreciated hearing from different leaders from different countries, from low income, middle income, and on high-income countries to share their experiences dealing with COVID-19 and insights they've gained retrospectively and discussions kind of like moving forward. I also appreciated, and I think CUGH does a lot of like focus on climate change and like biodiversity and the extinction crisis that we face and the implications of that, and the role that we humans played in all of this, and how we need to shift our mindset and behavior to kind of combat this. I also enjoyed conversations around social determinants of health and how climate change and the extinction crisis, COVID-19 also have the gravest impact on those that are already so marginalized. And one of the plenary sessions that I really enjoyed, but it's also very beyond like my area of expertise, kind of touched base on the corruption and how it has an impact on global health. And during COVID-19, there was a lot of money being shuffled and donated between different sectors and organizations and countries. And yeah, the speaker kind of talked on various people potentially taking advantage of it and how it has a tremendous impact on people's lives. Another session that I really enjoyed was the panel of female scientists kind of sharing their roles, leading various initiatives related to global health, but also their overall journey as female scientists in the global health sector, the challenges that they faced, but also the support that they received, the words of wisdom that they had for young female scientists, and also some of the structural changes that we need in order to truly contribute to global health with the potential that we have. So the overall answer to that question more directly is that one of my biggest highlight of attending CUGH was being able to expose to diverse topics that are beyond my research. And kind of hearing from presenters from diverse experts in their fields and nationality and types of work that they do, and kind of being able to reshift my perspective and the interconnectedness of these different topics and countries, and kind of being reminded that no one research topic or country solely exists by itself, and that it has so many ripple effects that we really need to think critically about these issues as a collective global community, and that many of these global issues require global solidarity. So yeah, that was my biggest takeaway from the conference. Thank you.
Well, that was really great, Han. And I'm reminded that in academia, so often we get focused down a very specific trail to develop our expertise. And if we're not careful, we're very, very narrow. And we're just trying to advance that edge. And we don't take that opportunity to retreat back and look at the arena that we're in and the other things that are going on around us. So really, really critical point. Thank you. Looking forward to the discussion. And if I am now going to ask Laura Rozek for her thoughts. Laura is no stranger to the seminar series. Laura is in our School of Public Health, and we really count on her in our center because she's one of the, I showed you our challenge groups on an earlier slide, and Laura is co-lead with Cheryl Moyer on a challenge group that looks at empowering women and communities. She also is in the International Institute, where she oversees the Southeast Asian studies, and is a molecular epidemiologist that looks at cancer, particularly in low resource countries. So Laura, we're interested in your perspectives from the meeting.
Thank you so much, Joe, and everyone who's here. I think this is such a valuable conversation to have as we start to think about how we can really engage the community around the world. I went to CUGH kind of with two things in mind. The first one comes a little bit from my work at the Center for Southeast Asian Studies, where we've had a seminar series all year that went virtual. And I think Jessica Riggs, who's our programmer, and I were kind of went into this thinking, like, how's this actually going to work out? And to our surprise, found that the more we engage with listservs around the world, the more people that would come to these seminars on Fridays. I mean, we had one seminar where I think we had somebody from almost every continent, and we were kind of joking about it. And so when I went to CUGH, I started to think, I went to it with the mind of, wow, how's this going to work out as a national meeting in terms of engaging people across the globe? And how is this going to work out when we think, post-pandemic, which I hear will happen at some point? And how will that happen in terms of trying to keep people engaged? In terms of like, let's not turn off the switch, because we have a lot of different people coming to our seminars and engaging in a lot of different ways. And then the second reason I went was because I always like going to CUGH to hear something that I haven't heard before. So doing global cancer, I'm really fortunate that we have a number of international meetings. So the UICC runs a really good meeting that's usually about every other year. The International Society for Environmental Epidemiology does a lot of cancer work, and they have a lot of great work that usually has a draw around the world. So when I go to CUGH, I like to go to hear things that are more topical. I like to be challenged. I like to hear about more provocative work. So I'll try to intertwine those two things that I kind of took a look at, and I have a few notes if you see me looking down. So one thing, I was really pleased overall by the number of international people and global scholars who appeared to be there. I was impressed. One of the ways I knew that they were there, and I couldn't tell if the chat function was on for every session, but man, when that chat function was on, it was really fun to see where people were coming from and going back and forth. Amy, it sounds like you were at the neocolonialism, which I know a lot of us went to. Fabulous. And there were people chatting, and it was so interesting, like throwing in comments. It was a brave thing for CUGH to do. God knows, I mean, I know we all teach, and I know we all know that things can go south pretty quickly. I was not in a situation where it went south. And I really appreciated that ability to interact, because going into the conference, I usually attend this in person, and being remote, it gave me this window into, wow, when we ask people from other countries to attend things remotely, they are doing what we are doing right now in the pandemic. They have a lot of competition for their time. They're usually running from thing to thing and sitting down, to join into the conference, which I know we were all doing. So this ability to kind of like hop in and use the chat, I thought this is a really good way to try to keep people engaged. And I really appreciated that chat function. And I hope there is some way that CUGH can keep this going forward. I think our center could do really like engaging people around the world and our partners. This is a great way to do it, is to just keep these seminars going, having them at times that people can realistically attend, which is so difficult with, even at Michigan, it's hard to get that done. As I said, most of the reason I go to CUGH is for these more provocative sessions, because my students have presented there. This is probably my fourth time attending CUGH. I've had a panel at CUGH. I always enjoy it. I like that the students that present there are usually, unlike some other conferences, the students are like the people on the ground. You can go talk to them, and they're the ones really doing the field work, because unfortunately as faculty, we don't generally have enough time to do it. So I appreciate it. I'm right there with Amy. I've started working with an anthropologist, and we're doing so we're gonna have to sit down and talk. And so, I mean, I don't know, Elizabeth Roberts is, brilliant anyway. And her session was great. There was a great session on gender, neocolonialism. And I thought I think there was one about integrating, I have the schedule right here, and I couldn't figure out what it was, but there was one that was looking at how to integrate and anti-Blackness and how we're training global health researchers. And I really enjoyed it. I think this year, and maybe it's because of the climate, instead of kind of standing back, I thought that the organizers really embraced these kind of provocative topics. And with the chat function, I thought that it was really, again, able to have some good discourse that I really enjoyed. I mean, I kind of found myself like, it was nice that weekend, wasn't it? I think I remember sitting on my front porch drinking coffee and thinking, this is a really nice way to see a conference. And so with that, I really enjoyed it. I think the challenges I see coming from that, or what it gave me a window into challenges were, how do we keep people this engaged as we move into a situation where we will go back in person? I miss being in person. I would much prefer to be in person. Like a lot of people, I have competing interests at home. So, I'd have my laptop propped up and cook dinner. I don't think that's a good way to go to a conference, but it kept me there. But I'd like these conferences in person, but how can we engage people as that happens? I think it's something we can ask us as a center, is how we can get people here and get them in the chat function, especially since we're so comfortable. And how can we keep these conversations moving forward? I think Amy pointed out the use of anthropology and area studies is something I encounter a lot in the Center for Southeast Asian Studies in the International Institute. But it's not easy. It's not terribly fundable. And I think Elizabeth Roberts, she calls it slow science, doesn't Liz? She says, like, this is slow science. So I think the more we're able to engage as a center and in the future in CUGH and putting together panels that combine these types of people. Her panel was great. And I really appreciated the way, again, CUGH kind of like took a lot of these topics head on and really attacked them. And I think it was a good lesson for us here at the center on, really engaging with things that maybe aren't easy and maybe aren't putting up. I'm an epidemiologist, so I like to see a table or graph probably more than the average population. I love results, ask my students. But I think it was a good lesson to me to say, like, let's walk out of our comfort zone a little bit and engage with other people and really see where we can go with it and not be so tied in that odds ratio. A little haphazard, but those were my thoughts coming out of CUGH.
Great. Thank you, Laura. Very nice, and something we can build on in discussion. So finally, looking forward to thoughts and reflections from Akbar Waljee, who's in our Department of Internal Medicine, Division of Gastroenterology in the medical school. Akbar also co-leads our data science challenge group with Brahmar Mukherjee in our School of Public Health. And Brahmar, I think CUGH was maybe a first time for you. I may be wrong on that, but I'm wondering what you saw and what some of your reactions were. So Akbar.
Thanks, Joe. Bear with me while I transition over to some slides too. Here we go. So it was a little tricky and I can't do it fast enough. And it always seems like it takes time goes by so much faster when you're on Zoom, just listening to dead silence. So that's one of the disadvantages of the Zoom. But I would love to share my reflections of the meeting. Primarily, that the one advantage of doing Zoom, besides echoing what Laura said, I'd much rather do this more personally, is that the highlight for that meeting was maybe listening to Dr. Anthony Fauci as a keynote speaker. And the one advantage for Zoom is that his face was right in my face, which means I felt like I was getting all this personal attention from Dr. Anthony Fauci, which was great from that perspective. Again, I don't know if it was actually a live presentation. It could have been taped, but at the same time, I felt it was very personal and truly a highlight of that of the conference. Like Joe mentioned, it was my first time, and I was doing it obviously for the first time on Zoom, so I wasn't quite sure exactly how it would go. But I have to echo what everybody else said at today's meeting, is that sometimes you forget your why. Why am I doing this? And sometimes your why is not exactly what everybody else's why is, especially in low and middle income countries. You know what needs to be fixed when you're really not listening to what the needs are in the community. I will also put a disclaimer here saying that things that resonate with me are not necessarily what resonates with everybody else. And so I tend to hear what I'm interested in too. But, it was a point of self-reflection as to why are we doing this and what's the important things that potentially could help the community at large. The importance of data, technology, and innovation came up multiple times for me, trying to understand why do we need to take advantage of this, especially in low and middle income countries where I think we sometimes underestimate the technology that exists there. For example, in Kenya, the fact that there's an entire monetary system based on M-Pesa, M meaning mobile, Pesa meaning money, that is the entire transaction of how people live their lives, and how could we potentially take advantage of these systems, this mobile technology, to improve the health and welfare of the community. Mental health, such an important topic that so that sometimes I feel we don't pay enough attention to, especially in COVID, where we're so isolated. The mental health issues that we struggle with in the high-income countries, I can't imagine what exists in low and middle-income countries. I think there was one statistics that I had heard early on that the rate of suicides during COVID in Japan were higher than the rates of death due to COVID early on during the highest rates of mortality. I know that, again, in Kenya, and some of this information is reflective of Kenya, mainly because I grew up in Kenya and pay attention to the health of the community there. The Kenyan government has made this a priority for their community because mental health is affecting them predominantly more than anything else right now. Nutrition, again, as a gastroenterologist, this is what resonated with me. But more importantly, it was the of nutrition. No longer are we facing nutrition as a malnutrition disorder, but really obesity, a non-communicable disease that's emerging more predominantly in low and middle income countries with the incorporation of the fast food diets that are again emerging and tend to be even cheaper than locally manufactured foods due to the synthetic nature of them. And again, this burden, this double burden, especially on the obesity side, I think are things that were emerging as something that's an important thing to think about. And then, like Joe mentioned, I think we don't think enough about impact. What is it that we can do, and what can we do to affect change that could be long lasting? Sometimes, especially in the academic environment, we're so focused on our grants, and we go into this and at the end of 5 years, you're done with your grant, but are we allowing for a sustainable, durable influence in low and middle income countries that goes beyond us and goes beyond our government? And so the importance of collaboration, it was highlighted so much more for me, and again, reflected on my why, which is, I tend to be more of an extrovert, and I enjoy the collaborations. I enjoy the excitement of hearing from the people that we're engaging with and seeing what is important to them and how can we actually contribute more in a meaningful way. Other takeaways, again, I mentioned the Dr. Anthony Fauci, but one of the things that resonated with me during his talk, leverage data, especially during the COVID context, right? It was so important for us to try and see how we could harmonize the data in a way that could allow for better coordination of the global data to have impact. And it highlighted the need for this. There's so much of a need for harmonizing the data in order to help the population more globally. But this doesn't come easy, right? There's so many barriers in terms of privacy, in terms of shareability, but made me think of potentially my interest in data and data science, where there are approaches. There's approaches of using synthetic data. There's approaches to using federated data, where, for example, you could create a model to predict mortality from COVID in one country, but not share the data, but share the model. And you bring all these models together to then sort of, evaluate them and maybe even come up with a composite model. So those are the things that were interesting me, and how I would actually execute on trying to harmonize the data for better coordination. How to advance innovation. Again, the use of artificial intelligence and machine learning methods to predict poor outcomes, predict who be at risk for developing diabetes if they had gestational diabetes. Could we use prediction models to actually look at these high target areas? Another area of interest for me that maybe would resonate with some of the attendees here, I think Lee Schroeder is on too, is how do we take commonly or routine available labs to identify potential risks in the future? So here in the United States, we do colorectal cancer screening at age 50, where there's a 3 to 5 developing colon cancer. those innovations, those colonoscopies don't exist in Africa or other low middle income countries? Can we use routine labs to identify trends in labs that may make us better identify who these high risk populations are? And then the last thing, which was, again, from Dr. Fauci, was how to talk to stakeholders. The importance of need to articulate facts. Those are what people hinge on. Then summarize the data in a way that makes sense to the public, and then provide actionable next steps. That three model approach, I think, really, really resonated with me. Providing the facts, summarizing the data, and providing the next actionable steps. Another takeaway from this was, again, tackling non-communicable diseases as a global health priority. Again, focused a lot on infectious diseases and HIV, and those still clearly very, very important. But again, what are we going to be facing the next 20 years that we need to be ready for to tackle? So predicting predicting NCDs like we talked about, and then again, point of care technology. There were representatives of the NIH there talking about what their priority areas are, and the two NIH representatives were coming from the informatics and biotechnology domain, as well as the mental health domain. And are there points of care technology that we could start working on that would help advance the future needs? What more could we do at UMM? It reinforced the importance of us spreading the word about impact. How can we be impactful? And Joe has really stressed that upon me, and I've learned so much from him around that. And that clearly is emerging as one of the main goals for the Center of Global Health and Equity. The importance of translation into guidelines and practice. So once we come up with information that needs to be more easily spread, how can we do that more appropriately in the form of guidelines to incorporate into practice? And how important it is to engage global health partners, that this can't be your only mission. It needs to be something that's actually useful to the environment that you're working in. The importance of creating platforms that bring people together, just like this today. I hope we can do more of this, even if it just means a few people engage word of mouth that will spread across campus. It's essential to bring resources together with good mentors, and then facilitate emerging problems in low and middle income countries. Really, that's the what of why I think what CGHE can bring to the U of M community. And then I'll end there.
Great, thank you, Akbar. I have to admit being a fan of Tony Fauci as well. And also, I was sitting on the board when we were trying to decide, do we have Tony Fauci speak? Can we count on him? He's talking everywhere. Is this a worn out person? Of course, he's inspiring and he's a beacon of truth. But every channel you turn to has got Tony Fauci. But I had probably my most profound aha moment from listening to him speak. And it's when he said, I don't think we're going to see a lot changing with the COVID epidemic until we see low-income countries starting to produce vaccines. When we see, right now it's the high-income countries, but as soon as we see the shift of this mRNA technology into low-income countries. And he drew an analogy that I was very familiar with. I always thought the big shift in HIV was when the drugs went off patent, but not really. Sure, the drugs went off patent, but it wasn't until India was producing those drugs in a very low-income way that the needle started to change for HIV. And he said, that's what we saw in HIV. The low-income countries and the middle-income countries are going to have to start producing their vaccines. We have to make this mRNA technology so robust that countries take that on. That was such a profound aha moment for me. And it was interesting. A couple of us were on a phone call 2 days ago with Sinead Faseha, one of our faculty who does so much, particularly for women's health in Africa. She's in Rwanda right now, helping the President Paul Kagame figure out how to produce mRNA vaccines in Rwanda, because that's going to be the future. These countries who are going to be able to produce their own vaccines. So no, he wasn't redundant. Inspiring as always, and definitely gave me an aha moment. So would like to just devote the next 25 minutes or so to just some discussion among panelists. Please, audience members, send in questions or things you're reacting to. I appreciate Kevin's comment here. And maybe I'll just pose this to any of the panelists who want to take it on. Storytelling was mentioned as an important aspect of global health research and partnership. I'm wondering if you could expand on any, quote, best practices, unquote, you may have seen, and if it seems to mostly come through an anthropology lens, or is it more widely applicable and practiced across fields? So is anyone willing to take that on?
So, Joe, Joe, I think I had mentioned create space for more storytelling as part of the work we do in the center. And I was mentioning that in the context of learning from our colleagues. But you can easily see how that could translate into the kind of research we do and the interactions we have with our partners. So, you know, I was introduced to this concept, you know, being trained in ethnographic methods, and somebody put it very simply to me. If you sit down and ask somebody very pointed questions about, for example, their educational experience, that can become very confining and feel a little bit cornering. But if you invite, you know, a child or a participant to tell you a story, tell me the story about growing up in this community, then what you're doing is you're giving people the chance to choose for themselves what's important. They decide what to put in front of you. They decide what to hold back on. So this kind of storytelling is a very important part of ethnographic interviewing, but we're also seeing outside of anthropology, we're seeing new movements around things like narrative inquiry. We're seeing that more and more in education. So it's again, it kind of gets to that notion of learners, especially younger learners, who could be confused or intimidated by certain kinds of interviews. But when you frame it in stories, here's a story about Joe the bear and why he went to the doctor. What do you think of that story? How would you tell your story about taking Joe the bear to the doctor? So people are playing with this as just a much more inviting and comfortable way to elicit information. And the other thing I'll mention, you know, is we're seeing this more and more mainstream in terms of oral histories and journals, right? How many of us love to listen to StoryCorps, and wow, do you get a different take on that person's lived experience than you would have reading a report or something else? So I'll stop there because I saw Laura lean in too.
No, I think those are great points. And I want to share, so I am not an ethnographer. I mean, anybody can tell you that I talk too fast. And, but, you know, Christabel Seifa and Cheryl Moyer and Emily Treleaven, who's over in ISR, we've been working with anthropologists at MSU and some people in Northern Thailand. And they're anthropologists. And we're trying to design studies for how we understand empowerment. Because as we've worked through these empowerment meetings, half of our meetings are like, what does empowerment mean? And of course, the answer is it means something different to everybody, depending on the context and depending on your privilege. I mean, as a privileged white woman, it's much different to me than to other people. And so as we started to talk about this, we started to work with anthropologists and trying to decide, like, what is a good process? Getting to the point where you even said, like, maybe we need to even take a step back from doing ethnographic research and have a qualitative study of our partners and ask them, like, you know, in an open way, like you just said, Amy, like, what works for you and what doesn't. And so I'm not sure that there's a process. I think, again, just from my very superficial knowledge and working with area studies people, every time I talk to an anthropologist, I think I always feel like they're giving me a new perspective on how to do work. So I don't know if it's always with the anthropologist, but it seems like a darn good way to start. Um, and so, but I think it seems to be, as we start to go into communities and really prioritize listening and prioritize the data that we get as opposed to the data that we have, it seems like this is not the worst way in the world to start, is with storytelling. And it's certainly worth a try. I think it's going to be laborious, and I think it's going to be slow. It's going to drive me nuts. It already kind of is. I mean, we talk about these. I'm like, how do you analyze these data? And they're like, oh, well, you transcribe them. I'm like, huh? But I think it's good. I'm completely out of my comfort zone. And I'll tell you a funny story. So Amanda Flame is the name of our anthropologist friend who's at Michigan State, and she's just brilliant and has this huge loose grant and studies all sorts of interesting things in northern Thailand. And we were talking, and I was like, oh, you know, what's it like to be in the field? And she points out that one of her, as an anthropologist, one of the privileges she has is that she can spend a year or two in the field. She was like, I'm sure it's epidemiologist, you can't go there. I said, oh no, my advisor would have killed me. And I asked her about some cool things she had seen, and she said, well, one of the biggest lessons was she went in and she was studying maternal outcomes and trying to work with people, and so she had this question. She said, well, you know, how do you prefer to deliver your baby? And she said this to a woman in the Highland region, and she said the woman looked at me like I was exactly nuts. Was like, huh? And she's like, you know, what is your preferred birth process? And she was like, the woman just like looked at her like crazy, like, don't you know how a baby is born? And kind of like was like laughing with her and like, oh, you maybe don't know this. And she's like, it all of a sudden dawned on me, like, I'm assuming choice here where there isn't one. And I'm assuming, and she said it was a real lesson to her to take a step back, which she had already known. But I keep that in the back of my mind, that, I mean, part of what I think the storytelling teaches you is that, like, everything we know, every question we ask has to be thought of in a context specific manner, and we need to understand the context.
Yeah, I think many of us were brought up academically with the tyranny of the p-value. If you're not doing something that can be expressed in terms of p-values, you're not doing something that's relevant. And it is something when we're thinking about, well, how are we going to talk about impact? Can we just express that with stories? And I think this conversation has brought it out nicely. No, it needs to begin with stories to be able to get down to the right questions that are going to reflect the impact and the needle that's moved relevant to how that population, that community defined it, rather than the way, you know, we come in with our own lens and choose to see things. So I think that's really important. So Akbar?
No, yeah, I was just gonna, resonate, say exactly what you're saying. But, it almost seems like we have to redefine some of the words that we use. Like even the term best practices, if you really think about it, you're asking yourself, what does that actually mean? Best practices for who and for where, right? A best practice in the United States may not necessarily be a best practice anywhere else in the world, right? It really depends on what's culturally appropriate, what the population is willing to take. And some of the concerns that even I have during COVID and vaccination is the interpretation of vaccinations for clearly everybody in the world, right? Is it, I hear people saying, vaccinations that may have animal products in it, among people that are vegetarian, what does that mean? There's still social stigmas related to getting COVID infections that nobody wants to talk about it. Yet the potential leaders who have the most potential impact are the ones not talking about it. And so, really the terminologies really need to be changed to be more culturally appropriate, more open. And I totally agree. The storytelling provides you a little bit of vulnerability, that if you're the person that's willing to give that story out and provide that vulnerability, you may enhance more of the trust.
I also definitely agree with all of the panelists here, and that storytelling is like such a powerful way of gathering a lot of context. I also think vice versa, when we like provide education too, depending on the context, storytelling is such a powerful tool. I think in a lot of like Western countries, we are taught, in bullet points, and like we understand the concepts, memorize them. But when we deliver different type of education in like sub-Saharan Africa, or a lot of my work was done in like rural Zambia, and if you tell them like, oh, these are the danger signs of like pregnancy, or like then they will not remember the bullet points 1, 2, 3, and 5. But if you tell them the stories of like the woman, were in her home and she decided not to travel to a health clinic to give birth, rather she decided to deliver at a home. And if you give them scenarios that they can relate to and that they can understand, then that also is like an amazing way to provide education and things that like really sticks to them too. So I think, yeah, the power of storytelling goes like both ways.
Really nice. I wonder if I could shift the conversation a little bit and pick up on something that that Laura commented on, and let me lead into it with another profound aha moment I had from the conference. A lot of times I go to these conferences, maybe like you're kind of surfing along, and then something hits you, aha. And the aha moment was in a conversation where the question was posed to the panelists: is anything good come out of this COVID pandemic? It's just been ravaging. Has it been anything good? My colleague, Nelson Siwan-Kambo, who is academic elder, former provost in Uganda, he said digital literacy, how we have become digitally literate, is transforming us in untold ways. And it ties in a little bit to what Laura noticed, which I did too. The international participation was so different this year. In prior meetings, always held in North America, there's this barrier of you gotta fly to North America, you're gonna be jet lagged, and that whole cultural shakeup, and people coming from low middle income countries, they can't come and climatize for 5 days. So they're disrupted, they can't get away, we don't have much participation. But here, they could blend this into their own life, and they could transport themselves virtually and be part of the conversation. They were running some of these conversations. This totally disrupted us. And we said, wow, do we really want to go back to that? So, when I take over leadership, I'm arguing strongly, and I think I'm going to carry the day for having the first meeting in Africa. We're trying to have it in Kigali. If you want to understand context and bring people into the discussion, go there. If we're talking about decolonizing global health, why do we keep expecting people to come to North America and validate what we think is going on in their environments? So, or do we keep up with this virtual environment? But Africa is a huge place, as you know, just because you hold it in Kigali doesn't mean it's not inconvenient for somebody in Accra, Maputo, to just go and pick up. So we're in this tension that I think a lot of learning communities are going to find themselves. How much should we retain of this virtual world? Like Laura, yeah, I like meeting up with people. But what's the trade-off there? That if suddenly people can't come, we have never had 2,000 people sign up and pay to come to a national meeting. It's usually around, our personal best prior to this was almost 1,900. So there were more people that signed up. We don't have the exact numbers from low and middle income countries. We've never had this many. So COVID ends, we all get vaccines, mRNA technology is more widespread. Should we go back to just face-to-face? Do we retain some of this virtual? Are there aspects of this meeting that probably we should institutionalize? Any thoughts or reactions?
All I can say is if there was a chat function where even if I went to a meeting and somehow, I mean, I'm hopeful that somehow we figure out the technology. I think this will be the limitation of having somebody in a room at Michigan or in a room, you know, somewhere in Africa or the in Southeast Asia. If we could figure out the technology to have both, and I'm not sure quite what that is, but man, if I was at a meeting, I would sit there and follow a chat on my phone or follow like people that having side discussions on my phone like I did this time. I thought it was great. I really had a good time. And so I feel like if there's some way that we could try to incorporate that. We're thinking, as I said, you know, I have this great programmer, Jessica Riggs, and I know she's combing technology to try to figure out how we could do this here at Michigan with our Friday seminar series. I don't want to give it up. We had a librarian from Singapore last time asking questions of our seminar speaker. How cool is that? It was a great discussion. So that's me more saying, I don't know how, but I don't see that it's even possible to go back right now. We're all, I mean, we're past a tipping point, I think.
I don't want to put you on the spot as I put you on the spot, but I wonder, is there a generational phenomena at all that you would speculate? You know, people my age, 65, you know, we're used to handshakes and hugs and creating community in real time. I think of my kids, and I think they're used to creating community and doing things in a different way. They're not as dependent on how I have standardized creating community. Any thoughts or observations you have from your perch?
I think that is a great thing that I also ponder too. And even there's a generation gap from like me to like some of the kids that I volunteered like teaching in like elementary school, and just their ability to like their way of building community is just like FaceTiming their friend and playing like video games virtually. And somehow that seems like very like enough and sufficient to them. And I think with COVID, all of that way of developing like friendship and community have been accelerated. And you know, the way that our generation functions on not even Facebook much, but like Instagram and TikTok and all that kind of stuff, and how each of those apps are also merged together and you can jump around from one or the other. And I mean, also like a majority of like a lot of my good friends from like childhood or like undergrad, even they're spread across the world. And the way that I stay in touch with them are through a lot of social media and, you know, Zoom calls and stuff like that. And so there definitely, I think, is a generational thing, but yeah, and I think it's gonna be more so like as, you know, the generation like gets like younger too. Yeah, but also like me personally, I didn't grow up with a lot of technology, like just traveling a lot with like my parents. So for me, even compared to a lot of other like friends, that physical component and like having conversations are so important for me personally to develop like deeper friendship and relationships. But I also have friends who are like okay with not having one-on-one like face-to-face conversation or even on the phone, and they can go like weeks without that and everything just being on like a chat or like in a written format. So I think there is still a lot of differences between like even just like my generation. Yeah, so I think with COVID, we'll see how much more things change after the post-pandemic world.
Yeah, I noticed that a little bit in Africa. I'm mindful that most people never used a landline. They just jumped right to cell phones. And I'm noticing a number of people in the places where I work, they're developing relationships using the internet. And I think of some highly valued relationships that I've been a part of now, that they're not surrogates for the real face-to-face relationship that were created. It is the relationship. And for some of them, they're going, my gosh, I'm connected. This is great. I don't have that comparative of real time that I'm going, yeah, it's not quite as good. It's like, it's great. I had nothing before. Now I've got this. So it's almost like that, kind of cell phone, not comparing it to landline or anything else. So that's great. Boy, we've got some active conversation in the chat boxes that I would encourage people to read. Some reflections from, again, Kevin again, and a takeaway from Craig. Yeah, the decolonization of global health is a huge thing. And how to address it. I think one of the problems is people in the United States and in privileged countries are trying to figure out how to lead a conversation on decolonizing global health. And we're trying to figure out how to talk about that. And it goes back to some of the parts of our earlier conversation is we're not competent to do that. We're maybe set up to listen and be educated and be led. But if all of a sudden we're wringing our hands saying, oh yeah, we've got to decolonize global health and we've got to figure it out, I'm glad we can name a problem, but we've got to tune in and be educated and be led. And I worry a little bit about this movement. It's just going to be painted with one brush. And as we've heard in the discussion, it's very context specific. And it depends on really connecting with people and building those relationships. And I think these are values that are going to be crucial to the center. We are at time, good people. So, I wanted to thank our panelists and really everyone for being part of the discussion. Again, this is what I was hoping that we could have a conversation about. I also wanted to point out that next year's CGH meeting is in Los Angeles, April 1st through 3rd. We're really wrestling with how much hybrid versus how much on the ground. Stay tuned. And University of Michigan has always been a big part of this, but I think our center hopefully will be leading some of the conversations and be good listeners and partners for our colleagues in other worlds, other countries. So with that, again, thank you. I wish everyone a good evening, and again, share any comments by email or follow-up discussions. It's all about us getting connected to each other. So thanks, everyone.